Alright, so everybody, good morning, welcome to class. My name is Eunice, you can call me Nurse Eunice, you can call me E, and I'll be your instructor for this weekend. Actually, months later, years later, you all can still contact me. I'll make sure you have my cell phone number, because I don't, unless you divorce me, I don't get rid of you. We're family forever, and beyond CNA, you're still gonna have questions. And so I just want to think that we always have, two-way communication. If you need something, if you text me, I can answer it. If you call me, more than likely, my phone is on Do Not Disturb because I'm teaching classes. And so it's just going to be easy to communicate via text. So welcome to class. We start off with introductions. So a little bit about myself. I've been doing the exam prep courses now for 15 years. What I'm teaching you is not necessarily real world. It's perfect world. You only got one patient. You've got 31 to 41 minutes to do these skills on this one patient. That is not going to be real world. Real world, you're going to have probably 12 to 15 patients depending on where you're working. You're partnered with 2 nurses, and you have to learn time management. I cannot teach you time management in a simulated hospital, nursing home, room. You're going to learn that when you get to the floor. And anything that I didn't teach you in class, you're going to learn while you're getting paid.
Yeah. Lovely part.
On the job training. So I've been doing the exam prep courses for 15 years. This year in August makes 25 years that I've been a nurse. So I've worked in various units. I usually don't do pediatrics. I usually deal with adult populations. And right now I'm a nurse educator, and I love what I do because it gives me, the hours that I need and the flexibility I need to put being a mom in front of being a nurse. And a lot of people do that backwards. You're always nursing instead of, momming, and 12-hour shifts are just not conducive to my son's schedule. So if you need to find me, more than likely I'm here teaching classes. So welcome to class. When you introduce yourselves to one another, tell us your first name, tell us the reason you're taking the CNA exam prep course, and a fun fact. First name, reason, fun fact. And would you please start?
Hello, I'm Zariah. A fun fact is I just graduated high school last year. And I wanted to take this course because I wanted to further, get some experience. Because I'm going to BCU in fall, so I'm doing nursing. So I was just doing a little experience just to get the feeling of everything.
And you can start networking early. They're going to try to convince you to start working in a hospital early. I'm going to try to persuade you or dissuade you. I don't want you doing that too soon because I need you focusing on school, and nursing school is hard enough. So you can do like home care, you can do sitter. You need to find a job that's going to allow you to do 4 or 8 hour shifts instead of mandating 12-hour shifts. And so just remember that it's like as soon as you start nursing school, because the hospitals need staff, they're like, hey, you know what? We need these nursing students. Not 12-hour shifts, not right now. So unless, maybe like during the summers if you're taking a break. So congratulations in advance. Wonderful. And you came in second. Would you introduce yourself?
I'm CNA. I want to increase my education, and plus I'm being pressured by too many people in my family.
Very good. Pressure.
I've been doing home health care for over 9 years, and they were like, go get your license. Go get your license, that's all. Because I have nurses, RNs, CNAs, that's all throughout my family, and that's like, what is taking you so long?
So what has been the hesitation?
First, my work schedule, and then I was looking online to find weekend classes, and I could never find one. Everybody was doing the week, and that would cut my hours and the time I needed to kind of be at my patients. Because of the company was that they were short-handed, then my patients would be without care.
That she's putting patients first, but this is the year of today.
Yeah, it is. That's why I told them. Yeah. This is me. I finally found the weekend class, and I wasn't gonna miss it for nothing.
Awesome. Now, did you give us a fun fact?
I don't know, did I? Oh, I'm just crazy.
Most healthcare professionals are, so you're in good hands.
I'm very loving and just love helping people. My friend, the first time I did this, because I was in management, restaurant management, for a long time before I started this. I was sitting outside the building. My cousin got me the job at her company, and I'm sitting outside the building, supposed to be inside. I called her, I said, I can't go in here. And she was like, what is wrong? I said, I'm scared because I don't know what to do. I've been restaurant management all this time. This is totally different. And she was like, think about it. Don't you take care of your grandma? I was like, yeah, she said, treat these people as if they was your grandparent. And it was like a relief. And I went in there, and my first client was the sweetest angel ever put on this earth.
That is so awesome.
Yeah.
So she loves home care, and so home care is also a lot of the younger CNAs, younger nurses, they kind of don't go into home care, but it still pays well and allows you to have those relationships that working in the hospital really doesn't. Because when you're in the hospital, it's rush. Okay? Working in home care, you get to eat with them, they take you to restaurants.
Man, they pay you, baby. Yeah, I'm telling you, all three of my families treated me like I was a part of their family.
Yeah. And then you get to study while you're in nursing school. All right, I'm stop. All right, so next.
That too.
All right, so please introduce yourself.
Yes. Hi, ladies. Good morning. I am Jamie. The reason I'm here is I actually own a home care agency. And basically, I've always taken the CNA training, but I never took the actual CNA test. So I'm here to get this training again because my back is expired. So I plan to.
You gonna go all the way through this time?
I'm gonna go all the way through this time. And a fun fact is that I am scheduled to take the HCA2 February 6th. Pray for me, y'all.
You got it.
To join the LPN program at FSCJ. So
Proud of y'all.
Yes.
All right, happy nursing.
I'm gonna get that soon. I can't do the nursing, I'm sorry, I don't like needles. So me and needles is not,
It's not like you putting them in yourself.
No, ma'am. Even if I see it. I finally got over just a little bit because I had to give my son a shot every day. He was doing it, my mom was doing it first, and I wanted to try it, and I was like this. He was like, Mommy, don't hurt me. I was like, okay, hold on. You talking about open your eyes?
oh no.
So it was a lady, she did like this, I saw it as a reel, so I saw it on Facebook. She had scared her husband so much. She said, I can't see. I don't know if you all saw this one, but now that I'm saying it, your phones are gonna listen and then the video is gonna pop up the next time you go to Facebook. And so she's like, I need to go to the emergency room right now, and she's panicked. And he's like grabbing everything, and when he gets to the door, she says, every time I close my eyes, I can't see.
Oh my God.
So you're trying to inject somebody with your eyes closed.
Yeah, he was like negative. And now I got to give myself those same shots.
So once you finish LPN school, starting next month, we should be having our IV therapy courses for LPNs.
Okay.
So usually once you have your clearance to test, you can do IV therapy, because believe it or not, nurses are not taught IV therapy. Yeah, LPNs is not part of your curriculum, so you would have to go back somewhere else to take an IV therapy course.
Okay.
All right, so everybody, good morning. It was so nice learning more about you all. If you'll turn to page 2 in your workbooks, these are your books to write on and write in. And I will also, if you'll please, I know that you two ladies completed your applications, if I'll take those, and then Jamie, on our first break, I'll get you don't have to fill it out now. We'll get it on the first break. And both of you all found us online, so thank you. I always like to hear how you found out about us. And the weekend schedule was what steered you toward something. We've been in the weekend classes since I started. Yeah, we've been in for a long time. And because I'm on the west side, and I'm not gonna throw up any signs right now. You know, I'm not gonna do it.
I was just happy you were close. That too.
All right, so page 2 in your books, we're never, unless you need to do so, we're more than likely not going to refer back to the table of contents. But I think this is important, especially when you're in nursing school. You will always come up and ask your nursing instructor, your faculty member, where to find something. Usually in the front of your books, there's a table of content, and in the back of your book, there's an index. So you should be able to find things on your own. But as we progress during the class, usually we stop at like page 79, so on page 379. From 79 to 103, that's your responsibility. So we're gonna cover skills, we're gonna review some questions, but I can't read a whole book to you all. I know you got it, okay? Especially if you're gonna be pre-nursing. Reading is very important. So page 4. I'm gonna skip through some of this because some of you Is there anyone who did not see the online orientation? Attendance, 2 days, attend both days. Cell phones, keep them on vibrate. If you do need to answer your phone, feel free to step outside to answer. Let's talk about the layout of the building, because I didn't do that. We have this room, which is our classroom. We have a clinical room in the back. It's pretty much one way in, one way out. And the restrooms are all the way down the hall as if you're going to exit. There's also a restroom in the bistro, the big restaurant. And so usually the first time you go to the restroom, I'll show you how to get there. And then after that, if you need to go to the restroom, just get up, at your leisure. Okay, and we take a few breaks during the course, but we don't take a lunch break. It's going to sound strange. We eat and learn. We do like little mini breaks. Because if we take a full lunch break, that's when you're here until 4 or 5 o'clock. And no offense, you're preparing to work as a healthcare provider. So I just want to teach you these bad techniques now.
You gotta learn how to walk by. Hey, I gotta go to sister.
I know, right?
All right, what you need over here?
All right, so we talked about the cell phone. Smoking, this is a smoke-free facility. If you need to go out and puff or vape or whatever it is you do, you have to do so in your car. Physical or mental disabilities, we usually don't have those issues. Our website is pretty specific. It says it's an accelerated course. You're gonna be learning skills. So usually I will do one demonstration and then you all will follow behind and do the demonstration. So with 3 students, that means you're seeing something multiple times. Plus we have the videos. So there's no reason for you to forget how to do a skill. Whatever I'm teaching you, please don't walk into your school and be like, Nurse Eunice taught me a different way. Every place you go, you learn the way that they do it. And by the end of it, once you're independent and on your own, you formulate your own way based off of everything that you have been taught along the way. Completing the course successfully, as with almost everything, your success greatly depends upon your motivation and effort. Students who are on time, pay attention, ask questions, and participate as expected should do well in the CNA exam prep course. We sincerely hope that you enjoy this course and gain valuable information for your future. Page 5, accessing our Google resource page. You all, Google is going away with Google Sites. And so all of our videos are available on our YouTube channel. So I used to have you go to a Google resource page, thank you.
That's right.
So I will figure out another way. For the next 2 months, you can still access the Google resource page by going to that site that's in your book, okay? But they're getting rid of the Google sites. All right, page 6. So when the camera goes off, I will give you my cell phone number, but you will have a business card, and the business card should have the spelling of my first name. All right, my name is spelled E-U-N-I-C-E, and then my email address is admin, A-D-M-I-N, at fltraining.com. All right, we have a couple of websites. We have our Facebook page, we have our YouTube channel. The Google resource page will be active for another 2 months. And then we also have our Amazon store where you can buy uniforms, accessories, supplies. If you needed gait belts for your home health aides and your CNAs, Jamie, we just have it where it's easy to find on our Amazon store. Job referrals. Honestly, if you can't find a job, it's because you don't want one. So we don't do placement. Last time I tried to do placement, you all didn't show up. What we do instead is we do referrals. We'll connect you with somebody who's looking to hire, and you go out and you do that whole interview process the way that normal people would. And that actually shows that you're vetted, because once you put your time into something, more than likely you'll show up. 7 at the top. So I'm going to read page 7 at the top. It says course orientation. To give you a better idea of what to expect and to assist you during your personal study time, the following is a course outline of the skills we will perform each day. This course will focus on demonstrating the proper technique of skills. Self-study and active participation are required in order for you to pass the State of Florida Certified Nursing Assessment Examination. So when you look at the various topics down below, the topic that's in the 3rd column says the review of practice questions. On each of your tables at your workstations, if you look through those staple packets, you should have practice questions. Guess what your homework is tonight, everybody? You're getting out of here early, you're gonna be exhausted, take a nap, wake up, do your practice questions. The very last page is an answer key. I'm just gonna tell you now. Do not look at the answer key until you have completed all of your questions. And then tomorrow, if there's something that you still didn't understand, put asterisks or a little star next to it, and those are the questions we'll begin reviewing tomorrow morning. The more questions you practice, the better you're going to be at answering questions, but it also teaches you terminology, which is why I have so many answer practice question videos on YouTube, and people are passing because once you hear somebody read it to you, and you can turn on captions. So not only do I have the question on the screen, you can turn on captions so you can see the words in a bigger print, but that's going to help you understand terminology and also answer your questions better. Practice makes perfect. I don't know what questions are on the actual state examination, but I do know that the only time our students fail the written or the question part of the exam is when they didn't study, if they already have poor reading skills and they didn't study, and or if they don't use the oral or the audio exam, which will be read to you. So they'll read the questions to you on your exam. Use what they have. If they're going to help you, my thought process is this. I work with brilliant minds, some really, really smart people who have bad bedside etiquette. So I don't need my CNA reading a book to me. I need my CNA passing this exam so he or she can provide the best bedside care possible. And usually the people who provide the best care are the ones who've been through some things, okay? Not the ones who are handed everything. And so, you know, reading is fundamental, but I'm here to help you all pass regardless. All right, so that's going to be our, your homework assignment is going to be a review of practice questions. And then we will go through this every day. And at the end of tomorrow, because we have a 2-day class, every box will be checked as completed. Page 8. All right, so how much is the Prometric CNA exam? $155, and that's as of right now, because sometimes they change the fees. And if there is a change, I'll usually post it on YouTube. I'll post it on Facebook, and or if I know that you recently took a class with us, I'll send you an email to let you know, hey, these are the changes, these are the new fees, etc. And would you please highlight Prometric's phone number and their website? And then if you want to keep your highlighter out, go ahead and highlight that long website that says license search under Florida Department of Health. It's the third one. Florida Department of Health license search, and then you put your highlighters up and I'll explain everything to you. So in order for you to be approved to sit for your state of Florida CNA examination, you have to complete an online application, which I have a video that shows you how to do so. And in the video it even says don't complete the application from your phone, because sometimes you complete it from your phone, you may miss something. The state is unforgiving. They don't like to give you back money. So I want you on a regular computer or a tablet, something that has a larger screen whenever you're completing your application. That's going to be $155. They're also going to need a recent background screening. Recent within like the last 9 to 12 months. It doesn't have to be, you know, like today or tomorrow. If you've not had a level 2 background screening within the last 9 months, you're going to need another level 2.
I ain't doing nothing. They said mine was good until 2026.
You did one for a different agency, and how can I say this nicely? Just pay them people and do your background
Yes,
screening.
ma'am.
I was expired.
I was just making sure, like, I know they said mine is good to the
So this is what I want you to think of. I know usually level 2s are good for 5 years. You're now seeking a professional license with a different agency, the Board of Nursing. If they go by a background screening that you did 4 years ago, and let's say you committed a crime,
I got you.
it's not updated,
Right.
and they're going to be at fault because they gave you a CNA license knowing that you did all types of stuff since 2021.
Gotcha.
And yours is probably also with a different agency, Department of Elder Affairs. Who does like home?
It's so mine's through APD.
No, you just applied for nursing school, right?
So I haven't done that yet.
Okay.
But my actual level 2 is about to expire.
Okay.
Yeah.
So you'll need one regardless.
Correct.
And then you and I tomorrow, usually at the end of the class, we'll just stay behind for about 10 minutes and do the background screenings. So So if you all want to do your background screenings while you're here tomorrow, you're welcome to do so. The fee is $87.50, or you can go usually schedule at like a UPS store in your community. And if that's something that you decide to do, I can tell you the website that you use to schedule at the UPS store.
Most likely I'll do it here.
All right, and so tomorrow,
Talk to mama. Payday to Friday. Mama, I need some money tomorrow.
all right, and so what you'll do is make sure you bring your identification, and I can do your background screening here.
Okay.
And so the reason why I had you highlight the website of Florida Department of Health for the licensee search is the day that you take your CNA examination, you know right then and there whether you pass or fail. And you're gonna leave with 2 pieces of paper, one for the written test, which is the questions, and then one for the skills test. It's gonna take about 3 days before your license number actually appears online. So technically, like 3 business days after your test, you don't wanna be waiting for a paper license to come to you. You can go to this long website, find your license number, put it on your resumes, and start putting your resumes out there, okay? So that would mean that an employer could interview you, but they couldn't hire you until you actually had your CNA license, which takes about 2 weeks. So you can start that process early. Basic life support or CPR classes. If you paid for your CPR, your basic life support in with your CNA, you don't have to be certified in basic life support before you take your exam. You have to be certified before you start seeking employment. The difference is regular CPR, layperson CPR, is for individuals. So let's say you working as a home health aide. If something were to happen, you're in the house by yourself, you probably don't have a first aid kit, a facial shield, all that other stuff, unless you bring it into the home.
Yeah.
You definitely don't have an AED. So you're calling 911, and so you're working as an individual, you're doing solo CPR, one rescuer CPR, that's layperson CPR. When you call 911 and they come in, 5 people come in. One person's carrying the AED, one has the airway bag in case they need to intubate, and now we have somebody who's starting IVs. That's basic life support. So as somebody who's seeking a CNA license, who's pre-nursing, etc., you have to take a basic life support class. It teaches individual CPR, but it teaches you how to work as a team also.
Okay.
All right, because
So I
teams
need
who
to
don't
be
work
arrested.
well together, your patients are gonna have bad outcomes.
Yeah, because I just had to renew my CPR twice.
So what we're gonna do is, we're gonna do baby steps. All right, you don't need BLS now. When do you need it? After you take the test. And if your agency, if you're still working in home care, they may not require it. It's usually not required till you wanna work in the hospital.
Hospital, yeah.
Yeah. Or until you apply for nursing school, and you already told us you're averse to needles.
As long as I gotta shoot nobody, I'm good. That's the only thing.
All right, and so what to do after you submit the application to Prometric? Let me say your name correctly. Soraya, can I please get you to read the first 2 paragraphs?
Check your bank account in 3 business days to make sure the funds have been removed from your banking account. Your application will not be processed without payment. Schedule your digital live scan fingerprints. There are fingerprinting sites located statewide.
Perfect, thank you so much. And then Jamie, can I get you to read the last 2 paragraphs?
1 week after your application and fingerprints have been completed, please contact Prometric at 888-277-3500 and inquire about your testing date. Keep calling every week until you have your exam date and location provided to you via phone.
And I'm gonna pause you. They hate that I say that. They hate it, they hate it. I know they're like, please stop calling me. But I feel that once you've paid your money, I should be able to call you, and if I have a question, you answer. So what's gonna happen is, if you don't follow up behind your exam, you don't get to choose your exam date. They choose it for you. And if you can't make that exam date, you forfeit your fees. So 1 week after your background screening and your application has been completed, it's not gonna hurt you to pick up the phone and say, hey, I was just, wondering if I had a test date yet, because you can change your test date for $25. But the longer you wait, the less control you have over your test date. They're gonna make you pay the full $155 to change your test date. All right, so if you'll read the last paragraph, please.
Do not wait for your admission letter to be emailed to you. Pick up the phone and inquire about your exam date so that you can pay to reschedule if necessary. The longer you wait to call, the less control you have over your test day, and you may be charged additional fees. If you miss your exam appointment, all of the fees paid are forfeited.
Yes, ma'am. So you're in nursing school, you got a lot going on, you know you work Monday through Friday, prepare to be at the testing site all day, literally all day. So you ain't got nothing else planned for that day. Okay? Page 9, you can read at your leisure. Page 10 talks about the clinical skills test and what you need to bring to the exam. I need you to highlight it. I want you to arrive to your exam at least 30 minutes before the start of your test. And your papers may say that one of your tests starts at 9 a.m. and that the second test starts at 9:05 a.m. It doesn't matter. I need you at the test site at 8:30.
Yes, ma'am.
The nurse will determine which test you perform first. You don't get to determine that, okay? And we'll talk about those individual tests on the next pages. They're gonna send you a letter, it's called an admission letter. They're gonna send it to you via email. And if you don't receive that letter, you forfeit your fees because you won't show up to the test on the right date. It also shows you your test location. So you wanna print that and bring it. The 2 identifications that are required, it can be your driver's license, your passport. If it has a photo, we call that a primary ID. So you need at least 1 primary and 1 secondary. A secondary ID could be your bank card, that you have to sign the back of it, because we know that if you have a credit card or a debit card with your name on it, the bank has gone through some type of, background check to make sure that this is actually you. If, whenever you're filling out your application, your driver's license has a middle name, but you do not put a middle name on your Prometric CNA application, they consider you to be 2 different people, and you will also forfeit your money. So when you watch the video of me telling you how to complete the application, step by step, just go through and complete the application with the video. What to wear? I was telling you all that you all look more like nurses today than I do, because you wore your scrubs, all right? So when you take your test, I need you to highlight that center area that has the parentheses. You're gonna wear a medical uniform. You have to have on socks. You must wear athletic shoes, non-skid shoes. It can be the nursing shoes. And then I want you to add another word. I want you to bring a mask because COVID rates are, going up in some areas. And I would hate for them to mandate masks again and you not bring one. So the bold area in parentheses where it says medical uniform, right above it.
We want to write again?
Oh, mask.
Mask.
And then once you're in nursing school, you don't have to go through this whole long drawn out process again. What's gonna happen is pretty much at the end of each of your classes, you go through this in like mini increments. They're gonna have a skills check-off day, and we already know who you are, but you come in your nurses clipboards and you're doing these skills in front of your nurses, the skills that you have practiced now for at least a week, you've perfected it, and then when you get through that particular class, you get to start the next class, you get to do a whole nother set of skills. But you're doing all that in-house, you're not having to go out to a testing center in order to get that done. Okay. Did I have you read yet? You did read.
Yes.
All right, so I'm gonna read under what to wear. Oh, let me also talk about it, because I have another student who called me at 8 a.m. one morning, a little upset because the dean wanted her to cut down her nails, take off the lashes, all the other stuff. Look, that's just standard code of conduct for any nursing school that you go to, not just because it's Bethune-Cookman. So let me see your nails, everybody. I'm so proud of y'all, yay!
You ain't gonna never see them.
All right, so hair pulled back. Usually you're gonna have the studs. So like these are actually too long, but they're not long enough to where if I was taking care of a patient, they can actually pull on my earrings and actually rip my ear. So you wanna be really careful with what you wear when you take your test.
My ears ain't even piercing good. These are clips. I just want to look a little cute.
Okay, so candidates taking the clinical skills test are required to wear flat, non-skid, closed-toed shoes. It is recommended a uniform or scrub be worn on the day of testing. Candidates may also either wear or bring a watch with a second hand. However, our students are asked not to wear a watch to avoid possible recontamination during the hand washing skill. So we all have these fancy watches now. One thing about the fancy watches is the screen is black. and then you move a little bit, and then, okay, now you can see. Imagine me trying to take a patient's pulse, but every 5 seconds my screen goes black. It's not even a benefit. So if you're going to have a watch, you need one of those old-fashioned watches with the hands that move. Tick-tock. On the day of your test, keep it in your pocket. If I have a medical uniform, I'd have a pocket right there. Keep it in your pocket. You're not going to wear it because whenever you're washing your hands, you also have to wash your wrist and not be unable to do so if the watch was in the way. That means that you and your nurse will be using the same timepiece during your test, and that's going to be the clock that's on the wall. That way everything is synced. We're now going to turn to page 12. All right, so let's talk about our 2 CNA examinations. The first we're going to talk about is the clinical CNA examination, and our book states that the computer will randomly select 3 skills for you to perform during your clinical skills exam. Additional skills that will be tested will be the use of gloves and proper hand washing procedures. You will be allotted a minimum of 31 minutes up to a maximum of 41 minutes in order to perform your skills. At the completion of your examination, you and your partner will switch roles and they will perform their 3 skills, which ends up being 5 skills total with gloves and hand washing. If a skill involves nudity, the role of the resident will be played by a medical mannequin. So if you'll please pick up your highlighters. I need you to highlight 31 to 41 minutes. And then the area that has parentheses where it says 5 skills total, with what 2 skills?
Gloves and hand
Gloves and hand washing. So even though they give you 3 main titles, you still gotta wash your hands, which would be a 4th skill, and then you still at some point have to put on and remove gloves. That'll be a 5th skill. So that's what's required in order for you to pass the clinical portion of the CNA exam. For the written portion of the exam, our textbook states, the written test is taken on a computer and consists of 60 multiple choice questions that evaluate your overall knowledge and skills in providing safe and competent care. The test has 50 scored questions and 10 unscored items used for statistical analysis. You will have 90 minutes to complete the test. I need you to highlight 60 questions and 90 minutes. So you have to be prepared to be at this testing site all day because you're not the only tester. There can be in some locations up to 16 testers per day. Everybody paired up. So if you and your partner are performing skills, she gets 31 to 41 minutes, you get 31 to 41 minutes, and then you switch off. And now we have 8 other pairs that also have to go into that room and perform their skills too. So keep some food in your car. I know. It's a long day. Yes. You only have so many nurses. Remember, nursing shortage, which is why you all are going to the medical field. And so there are going to be nurses who will be evaluating you. In previous years, there were 2 nurses evaluating you. What's been happening commonly in our area is because of the nursing shortage, you only have 1 nurse who's doing all of the evaluations. So be really nice and really patient. Keep some food in your car, because while you're waiting to be called, as soon as they walk in, you can run to your car really quickly, get some food, and then come back in, hopefully in about 30, 45 minutes. Or you and your partner can, what I've been hearing is your partner will let you go to the car, and then she'll come out and notify you whenever, hey, let's switch. And then you'll do the same. That way you all don't miss your turn. You have to show up on time, but I won't say you have to necessarily stay at the test site unless they watch this video and then they were like, oh my God, they're letting them go to their cars. I'm just saying what I heard. I have no proof. All right, so let's talk about the CNA audio test. The written test can be taken in an audio format. During an audio test, you will be able to hear the questions read to you while reading and answering questions on the computer. You may replay questions as many times as needed. The audio administration may be helpful for candidates who have a reading disability, limited reading skills, or those who consider English their second language. Candidates who would like to take the audio test should select this option on the application form. It does not cost more money. Page 13, advice to help you pass the written examination. The first is to take the written exam seriously and study for the written exam as well as the clinical test. Practice exam questions nightly and look up any unfamiliar medical terms. The second one states, do not change your answers. Always select the option that will be the safest for you and those in your care. So what I find is when people have experience, or based off of what they've seen in the hospital, they usually answer the questions incorrectly because they're thinking about the fastest way to do something, not the safest way. When you're taking this test, you don't have 10 patients. You have one patient. You have all the time you need to do that extra step, okay? And you can also mark questions on your exam to go back and review. So if there's something you're unsure about, just mark it, go back and review it, and you have time to go back and look at all of your questions because you have up to 90 minutes. I shouldn't say all of them. What I want you to do is try to practice answering, set a timer. All right, so I'm going to rephrase that. I want you to practice taking the question and actually getting the question answered within 1 minute and 30 seconds. And just set your timer on your phone. All right, so the next one is avoid answers with words such as always and never. Healthcare is individualized and we rarely take a one-size-fits-all approach to patient care. So patients have care plans that are individualized to the particular patient. So if all of us had the same diagnosis, I may not want to accept blood because I'm a Jehovah's Witness. You may not eat meat because of your religion. We cannot just treat all these patients as if they're the same. So whenever we have these care plans, your job is to make sure that the care plan is being followed. And so we usually don't say never because we're going to find a way to keep that patient happy. And whether you believe it or not, hospitals don't compete with other hospitals. Hospitals compete with Walt Disney World. Why do I say that?
There's a lot of accidents.
Not there's a lot of accidents.
Fairy tale land.
Because we want to provide perfect care and we want you to remember all the good things about this hospital so that when you decide to have a cardiac surgery, you decide to have a baby, I want you coming back here because you had this experience. Yeah.
The experience. I got you.
So you said fairy tale land because we know we don't have enough staff. So you want to provide this excellent care, but we don't have the staff to do so. So you do the best that you can with the resources that you have. All right, so know the role of the nursing assistant. You are not the nurse. Notify the nurse in case of an emergency or if there are changes in your patient's condition. And so a scenario that I like to put here is you are the CNA, you're working in a nursing home at night. Usually you don't have RNs on night shift in a nursing home. You have LPNs. Still nurses, but they can do less functions than what the RN can do. So we have the LPN. How many LPNs do you think would be in a nursing home on the night shift if the nursing home had 45 patients? 1 to 2. Yes, a lot of work. So guess how many patients my CNA may have? Out of 45 patients, half. So you got 1 LPN and 2 CNAs of patients on the floor, but they're not in cardiac arrest. They're still breathing. What do you do?
Repeat that question.
Patients on the floor, they're not in cardiac arrest, so therefore you don't have to start performing CPR. They're still breathing. What do?
Call for the LPN?
Call for the nurse.
Yeah.
Do you leave the room to call for the nurse?
No.
No.
You
How do you
should
get help
have
in the
a call
room?
button.
So if you don't have a panic button, usually there's a button you can press on the wall. In the bathroom, usually there's an emergency cord that can be pulled. I'm really proud of you all for not trying to get the patient up by yourself. So what you're gonna do is you're not the nurse. I need you to keep that patient on the floor and keep them comfortable. Maybe put a pillow under their head. You can look out the door. Usually whenever you press the panic button, there's a light flashing outside the door. But if that 1 LPN is in room 45 and you're in room 1, it's gonna take a while for her to come out and to, alert you. So whenever you scream for help, you don't scream nurse. You scream help because there was another CNA who was a few doors down who can run and go get that nurse for you. Or there was a doctor or a physical therapist there. At the end of the day, I don't care who helps me as long as they are authorized to do so. So now we have team lift. We get this person back into bed. What is the CNA's role? Think about all these people at the bedside. My CNA has a role. What do you think the nurse is doing?
Check the virus.
That's not the nurse's job. I got
That's what we're
CNA.
doing.
Thank you.
Now I was answering to check the vitals for us. Sorry. I should have said
So
check
your
the vitals.
nurse is
The
doing
CNA
that
should check
head
the
to do
vitals.
assessment. Because I have to now call the doctor and say, hey, this patient has fallen. I need to know where the bruises are, where the pain is, what x-rays need to be ordered. So I need my CNA getting those vital signs. So when I call the doctor, I have everything like packaged together, giving him a full picture or her a full picture of his patient without them actually being there. Now that the patient is settled, blood pressure stable, patient has urinated on the floor so they don't have to urinate anymore. What do we do now as a CNA?
Okay,
Give
just,
them a bath.
Give them a
give a
bath.
bath. Yeah.
So comfort does whenever it's an emergency. You want to be comforting, but comfort isn't your priority when we're trying to stabilize a patient. We get them stabilized first, and then while I'm in the room doing my assessment, you can run out and get all of your bath supplies once the blood pressure's done, once the vital signs are done. That takes a whole 1 minute to get all the vital signs. You can run in to get your supplies, and then when you're in the room giving the bath, I go out and I call who? The doctor. So that's how we work together.
Teamwork.
What do you document?
The vitals.
The vitals and what else?
The
Fall.
The fall. Now be careful with the fall. And the bath. Look, she got everything. She like, hey, the bruises and the bath.
Yeah, all of it.
So be careful with documenting that they fail.
Mhm.
Because if you document that they failed, the lawyer's gonna ask, well, why didn't you stop the?
Fall. Okay.
Because they didn't fall,
Technically.
you found them on the floor.
Mhm.
That's what you found. You found them on the floor. Because I know you're a good CNA and you would prevent a fall.
Mhm. Yeah,
Mhm.
plenty of
Yeah.
time. Had to die, like I'm playing football. Hey, where you going?
Unfortunately, there was a CNA who tried to break the fall, and she did. She broke the fall of her patient, but she was really petite and short, and he was larger and taller. And when he fell on her, she fell backwards and it ended up breaking both of her kneecaps. So I need for you to use wisdom when you're walking these patients who are bigger than you and heavier than you. And sometimes you'll see us allow them to walk with the wheelchair, and they're holding on to the handles of the wheelchair. No one's in the seat. They're holding on to the handles of the wheelchair. And in that way, whenever they get tired, we can turn that wheelchair around, sit them in it, and push them back into their room. Or the walkers with wheels, some of the walkers will have a seat, and also utilizing gait belts, etc. So whatever equipment the facility has, use it. Or if you're in home care and you're walking someone and they don't have the proper equipment, you can order your own equipment for $10. So you don't need to be walking these huge people without assistance. Okay. Okay. So learn how to prioritize care, which we just covered. Taking the resident's vital signs may be more of a priority than giving someone a bath or keeping them comfortable during an emergency situation. Example, a recent fall. Take the vital signs first, and once the resident is stable, then you can give them a bath. Don't forget to document. If you do not document your findings, you have no proof to support the care you provided. Develop a study plan. Woohoo! Practice a few questions and a few skills every day. If you have testing anxiety, hint, hint. Research videos on how to reduce testing anxiety and how to improve focus and confidence. Preparation and just talking through this is going to help you a whole bunch. And when you get really nervous at the test site, put my brown face on top of your nurse evaluator's body. Because if you do the skills in front of me, you can do them in front of anybody. Okay? Don't forget to wash your hands, Lord. All the stuff we teach y'all. Y'all get the test site and y'all forget priority number one. Don't forget to wash your hands. I had this one student, she was done with me and I was done with her at this point. And it was like, she was like, do I need to wash my hands? And the only thing I think of, do you want to die? It was like, is that serious? Washing your hands prevents you from contaminating yourself, prevents you from contaminating your car, prevents you from contaminating your kids, your grandmama. Yes, it is that important. I need for you to wash your hands before and after every skill. Pages 14 and 15 go together. On page 15, I want you to highlight HCC. That's our acronym. So only our students know about this acronym, and the ones who email me later and be like, hey, you mentioned HCC, what does that stand for? So hands, curtain, and call bell. Whenever you enter your room, during your introduction and greeting, I want you focusing on you're gonna greet the person and then immediately focus on hand washing. Otherwise, I was out in the hall, I've touched things, I'm coming into a patient's room, patient who could be on chemo because they have cancer, and I'm just gonna start touching them and touching all their items. I'm bringing outside germs into their room. So before you touch anything, just wash your hands. And someone's like, well, Eunice, I'm gonna contaminate my hands on the curtain. you're about to touch a whole patient.
Mhm.
You're about to contaminate your hands regardless. What's inside of her room are her germs. Don't bring outside germs into her room. So whenever you enter the room, practice the steps on page 14. Number one, you're gonna knock on the door and enter the room, and we will practice this around lunchtime. Number two, you're gonna greet the resident by their names. We can't use those pet names such as honey, sugar, or
That's
baby.
hard.
I hate that.
I know, I don't care how tempting it is.
Well, I've been with my patient for years, so I'm so used to saying it, because I have to keep her calm.
Well, this is what I want you to think of. This was a scenario. A CNA was calling a male patient baby, and he was eating it up.
Oh, yeah, I got you.
Mhm.
And then the wife was in the room, and the CNA did what she's always done. How do you think the wife felt?
Uh-huh.
Yeah.
Yeah.
Why are you calling my husband baby?
Right.
Yeah, his name is Mr. Powell.
Yeah.
Yeah.
I get that with.
Number three, identify yourself, including your name and title. Hello, my name is Eunice, and I will be your CNA today. That's really important because they're seeing so many people come in and out of their rooms. They need to know that they can't necessarily ask you for pain medicine because they're seeing you all the time. So they're like, I just asked you for pain medicine. I related to your nurse. I am your CNA. I cannot administer medications, but I did let the nurse know when she's en route.
Gotcha.
Explain why you are there and obtain a resident's permission before starting the skill. So we talked about your clinical test, and it's going to have skills that you have to perform. You're going to say whatever skills is on your paper. So I'm here to take your pulse. May I take your pulse now? At the test site, no one can refuse. In the real world, you wouldn't just go in the room and take someone's pulse. It'd be like a full set of vital signs. But Mr. Paul did not sleep last night. And when you go in at 7 a.m. to take his vital signs, he tells you no. What do you do?
Respect what he said and.
I'm gonna need y'all to be
Come back in like an
I'm
hour.
gonna need y'all to be a little more aggressive, just a little bit. And not necessarily aggressive, find the reason why.
Okay.
Okay. Can
No.
you tell me why, please?
I didn't sleep last night. Y'all always in my room, always bothering me.
Okay, well, I'll come back later.
So let's try this a different way.
I'll go.
Because when people are ill, they're not as nice and they're not as patient as they would be. But we're in the hospital, and unfortunately, people in the hospital are not there to get rest. We're there to get you better. And the reason why we need these vital signs at 7 a.m. is because number one, your nurse is in there pulling the medications. Number two, your doctor's gonna be there by 8 a.m. And I can't be like, he was just having a really bad morning and I did not get his vital signs. So I want you all to pretend that you're Mr. Paul. Would you please be Mr. Paul? Hey, Mr. Paul, my name is Eunice. I'm your CNA today. I'm here to get your vital signs. Is that okay?
Yes.
No, it's my
Oh,
time.
no.
Mr. Paul, can you tell me why you don't want your vital signs done this morning?
I didn't get any sleep last night.
You know what? I hate that. What was happening outside so I can let the nurse know?
Oh, it's just too loud.
Oh, no, we're not gonna have that. You know what? Can I get your vital signs and then I'm gonna let the nurse know you didn't get any sleep? Do you know if you have any anti-anxiety medications or anything else ordered? So I've let your nurse know we can get that done right now. See? I made it all about him.
Yeah, gotcha.
And pretty much he wants me to stop talking.
Mhm.
It'd be different if he was being belligerent, if he was being irate, if he was throwing stuff at me. That's when you go ahead and you take that LB line, go get that nurse right away. But this patient isn't being rude. He's calm and he's letting you know, hey, I didn't sleep last night. So you know what my job is today? Is to get these vital signs and to get you some sleep.
Right.
Oh, I like her. Now, if he still says no, at least you tried. Because when you go to tell the nurse that out of 15 patients, you only got 5 vital signs, because everybody's saying no, because they didn't sleep last night, because they were cold because of this. At least I know that I can trust you enough to try to push through their rejections to get your job done. Because if you get your job done, you help me and you help that patient. All right, so we only accept the first no when they're being really, really, really mean and we're afraid for our lives. Imagine me trying to give someone an IV. You think people are gonna be like, oh yeah, take my arm. I really have to do a lot of explaining so that they understand the reason. All right. And when in doubt, now you can go get your nurse because this person absolutely refused to let you get their vital signs. I want you, whenever you document, you have to document what really happened. Attempted vital signs, patient refused, nurse notified. You can't document that and you have not notified the nurse. You're gonna notify the nurse because now I'm coming around with my medications and now it's gonna be on me to try to get those vital signs because I can't give you pills without those documented. I need them documented. And that's how we usually work together as a team. But if you don't tell me, I don't know. And usually the only time you're gonna tell your nurse something in the facility, because everything goes into a computer, is if it's abnormal. If it's normal, you don't come and tell me anything. If it's abnormal, hey, Eunice, the blood pressure is high, that's gonna make that patient a priority. I need to see them before I see my others. All right, so number 5, wash your hands before touching a resident. This is a failing point. It's bold, y'all. You may wanna highlight it. Number 6, pull shut the privacy curtain or door. 7, apply gloves if they're needed. And 8, perform the skill. What does HCC stand for?
Hand washing, curtains, and call
All
bell.
right, so when I knock, I want you all to say come in, and this time you are going to say yes because you're at the testing site, and at the testing site, no one can say no.
Come in.
Hi, good morning, my name is Eunice, I'm your CNA today, I'm here to take your pulse, is that okay?
Yes.
Before I begin, let me go wash my hands. So I'm gonna show you how to do the hand washing skill. Once your hands are clean, you can touch anything in the room. I try to keep you the same, doing the same exact standardized steps. I'm near the curtain, I'm going to close the curtain, provide privacy. And then I'm going to, they have a handheld device called a call button, which you'll see in the clinical room. I'm gonna take that device out their hand because if I'm in the room with them, they don't need to be holding on to it.
Yeah.
I'm now gonna fast forward. I did the skill. Now let's turn to page 17. 17 talks about the exiting procedure. At the very bottom of your book, what's the acronym?
ACCD.
All right, so what do you think I have to do? And it doesn't have to be in this order, but what do you think I do at the end of my skill? Document. Okay, I just took the pulse. I'm gonna document the pulse of 78. What else do I need to do?
Oh,
No,
make
call-
a skill.
The call
Call
bell.
bell,
Put 'em-
yeah.
Give them the call bell, and do you put it beside them? Where do you place it?
In their hand.
Directly in their hand, and you always want to ask, you want to be proactive, is there anything else I can do for you? So they have the call bell, and this person says no, because they're a student like you at the test site, they just want to get home. So no, they don't want anything else. What would be next? So I did documentation, I did call bell, what's next?
Reopen the curtain.
Open the curtain, and then before I head out, I have
Wash.
to wash my hands. So even though I have my acronym there is HCCD, at the end, it doesn't matter the order. I just need you to do those 4 steps at the end of every skill. I'm so proud of you all. So I'm gonna read page 17, exiting procedure, practice the skills. After you have performed the skill, you must, number 1, leave the area clean and tidy, meet discounts. 2, place the call bell in the resident's hands and ask if there is anything else that is needed. 3, open the privacy curtain. 4, discard gloves if applicable and then wash your hands. 5, document your findings and the care provided if you've not already done so. And then number 6, I want you to highlight this. I want you to perform a 5-second scan of your room. So before you ever say that you're done with a skill, you look back and assess your work. And what you want to assess is you want to make sure that all the procedures have been done and that you have maintained the patient's right to safety, comfort, and privacy before you exit the room. And again, we'll be practicing this in real time in a few moments. Page 16 is a quick page. As you're performing your skills, your nurses are evaluating you on your indirect care measures. We talked about a patient who had a diagnosis of cancer who was on chemotherapy. What do you know about their immune systems?
Sweet.
So we have a weakened immune system. So that means that anything we bring into their room, they're going to contract it, and it's going to be really bad. It's actually going to prolong their hospital stay, etc. So we want to use very good infection control measures with them. And the first infection control measure, the barrier, is going to be hand washing. You want to make sure you wash your hands. The sanitizers don't kill every germ. There's going to be some germs like C. diff, because it's encapsulated, the sanitizer cannot penetrate it, so you can't use hand sanitizer on everything. If we know the person has the germ or the bug, we'll put a sign on their door that says like contact isolations or respiratory isolations, and then it will usually say wash your hands. You cannot use hand sanitizer. At the test site, hand sanitizer is never an option anyway. You can only wash your hands. Other infection control measures is we can't be shaking linens. What happens whenever we shake our linens? What's released? Dust and particles, etc. if my uniform touches the bed, so when you're in the room, you're gonna get mad at me because stuff touches you, I have you redo it, fold the towel back up, pick it up, unfold it, because if things are touching you, you're now contaminating your patient or vice versa, because you used it on the patient and then brought it towards your body. But I was making someone's bed and my legs touched their bed. They had C. diff, which is that very foul smelling diarrhea that's easily passed from one patient to another. And now I go into my patient's room who has cancer. And when I'm making her bed, my legs touch her bed. What did I just do?
Cross-contaminated.
I gave her that. Okay, I cross-contaminated. So when you're taking your tests, your nurses are also making sure that your uniforms are not touching anything, including the bedding. We got this, all right? All right, so promote resident comfort. Whenever you're taking care of somebody who is in a coma or nonverbal, how do you know if they're in pain?
They be moaning and groaning.
They could be moaning, groaning, something, all right? If
Facial
they're
expression.
facial expressions, guarding sometimes, they'll hold an extremity. Or if they have the telemetry monitor, the heart rate part, whenever you turn them, what are you gonna notice about the heart rate? It's gonna go up. That will be a sign right there, like, okay, maybe I should lay them back down and get my nurse in this room. Or maybe their oxygen saturations will go down. So anytime a patient is in distress, even though they may not be able to say it, there are usually gonna be some other signs. And whenever you go to like your medical offices, the doctor's office, they have the smiley face scale.
Yeah, I'm just saying like this.
Yeah. So my son was like, ooh, he's getting mad. I was like, well, it doesn't work that way, but you know, but he was able to see the transition. And so even if, let's say, someone speaks a different language, the easiest thing you could do is just show them that scale, so they'll be able to tell you how they're feeling at that time. Okay. Promote residents' rights. Every person has rights. They have a right to decide what they want to wear, what they want to eat. Your job is to allow them to maintain their rights. We don't do everything for our patients. When I say we don't do everything for them, we want them to be as independent as possible for as long as possible. And if you start doing everything for your patient, Jamie, when I come in and I'm like, oh no, Miss Lucas, you can feed yourself. You can wash your face. You can help me dress you. What is she gonna say to me?
Miss Jamie, do this for me all the time.
Oh, Miss Jamie do, huh?
Well, I am Miss Jamie today.
So you encouraging them to do as much as they can actually helps all the staff in that facility. Okay, and then the last one is just what we've already stated. The last paragraph for promote resident safety says never leave a resident who is at risk of injury alone. We talked about that during our scenario. You're going to stay with the resident and call for help while you are with the resident. So you all, we have done all of our intro part. We have a video online that shows you how to apply for your CNA examination. Is there anyone who needs access to that video? Because I can show you how to access it now. I love y'all. Okay, all right, so I'll show you that during our break and I'll give you my cell phone number. So before you get up for your break, just remain seated and go back to maybe like page 4 or 5 so I can give you my cell phone number.